his way to Nantucket for Thanksgiving, Joe Biden left President-elect Trump another parting gift. Biden wants to make Ozempic free for overweight people on Medicare and Medicaid. Who could be against Ozempic? Who could be against free Ozempic? Turns out Trump's new health czar and Make America Healthy Again crusader, Robert F. Kennedy Jr., is just that man.
For half the price of Ozempic, we could purchase regeneratively raised organic agriculture, or organic food for every American, 3 meals a day, and gym membership for every obese American. They make this drug in Denmark, and in Denmark, they do not recommend it for diabetes or for obesity. They recommend dietary and behavioral changes. In our country, they're counting on selling it to Americans because we're so stupid and so addicted to drugs.
So here's how it works. More than 100 million Americans are considered obese. If Biden goes through with the proposal, the Trump administration will not only have to pay for the Ozempic, but deal with Kennedy, who wants to take it away, and probably a lot of Americans who would then like their Ozempic. Dr. Deborah Birx, former White House COVID response coordinator, is with us now. Dr. Birx, it's always good to see you back here. And boy, like to do this 54 days before the administration changes, it feels like this is President Biden just leaving one there on the table for him, huh?
I think they can really turn this into an opportunity. So he can really, Robert Kennedy can really bring forward his concept about clean food, decreasing additives. Dr. Oz can bring together his clean food, exercise, and they can have a real debate about what is best for the American people and lay out their plan. I think he can turn this into a tremendous opportunity. There will be individuals that fail. It happens with all things in medicine where you have to provide additional support, but he would be able to both have what he wants to do with diet and exercise and support the people who need additional support. And he could take control of the message. I think it's a layup for them and how they could really approach this.
For them being Team Trump to sort of take this and say, okay, you can have free Ozempic, or you can have a gym membership, or you can have both. In the like, just in terms of how this works, is it really up to the Biden administration to just unilaterally say this? You know, $35 billion is what it would cost America to give this drug out?
No, that's what I'm talking about. This is a time where they could have that debate.
Oh, you do. You have that debate right now.
Yes, because it's open for comment. The rulemaking takes a lot of time within CMS, so they cannot do this in the next 60 days. It will be open for comment. It will need congressional support, but they can start with their own messaging now and talk about what their approach is going to be and where that narrow for those people who need it. I don't think you give it everybody, but you can really put out the food piece and the exercise piece, and the people who fail that could have this as a safety net. So it gives them a real opportunity to lay out what their plan for America is.
One thing I've noticed from the scientific community, and I use intentionally a very broad umbrella when I say that, is this reflexive need to discredit everything that Robert F. Kennedy Jr. says because he has some admittedly wackadoodle ideas on some things. Why do you think they're so threatened by him on the very legitimate points of why is a drug used in the United States for diabetes that's not used in Denmark? Why have disease rates in America skyrocketed? Why does our food have so many chemicals in it?
I think sometimes in public health and in the science community, they think that Americans can't understand nuance, just like you just talked about on the last segment, that they think that we can't understand the difference between clean food, exercise, and the potential need for a weight loss drug on top of that in a subgroup of patients. I think they think the American people can't understand how these things work. I find no matter where I've worked in the world, communities and people can understand you if you
Yep.
explain it to them correctly. And we demean people by acting like they can't understand science and data. They can. I've seen it every place I've worked. And I think that's why they can really turn this into an opportunity to come forth with their information and data and really sell it to the American people. The American people are smart. They'll understand it. Now, that said, there are always a segment that will need additional support.
No,
and so
I get it. I think you're such a diplomat, though. You're such a diplomat, because I was about to say, yeah, because you don't win over people by telling them they're stupid. Not understand is a much more diplomatic way to say it, ma'am. Thank you very much. It's good to see you. Thanks for watching. Go to joinnn.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.